Hey guys, Brenden here, and today I want to share a story with you on how this bodybuilder by the name of Bostin Loyd took this fat loss peptide called adipotide and how it pushed him into stage 5 kidney failure. But first, if this was a Khavinson's peptide which he took, for example, then you wouldn't have to worry about overdosing it because, while you may get some side effects, you're not going to actually get organ damage. They have been studied extensively at up to 1,000 times their normal dosages for an extended period of time, such as 6 months, and they've found to not cause any organ injuries. And this has been confirmed on not only blood work, but also imaging, in which every organ has been checked. But I take this very seriously, because people often don't get the good results that they deserve with peptides if they're dosing them wrong. And a good example of this is how most people recommend a mots-c dosage, which is just far too low. Yeah, you may get some benefits from their recommendations, but you're really leaving a lot on the table by not dosing it optimally. And another example is FOXO4-DRI. People often dose this over 50 times too low, and I don't even see how they're going to get any benefits out of it. But this is the type of stuff we're dealing with, unfortunately. However, in Bostin Loyd's case, he ended up taking way too much of a peptide which was studied in mice and monkeys. So he didn't do the dose conversion correctly, or maybe he assumed that it wouldn't be toxic in these higher dosages. And so what happens with adipotide is effectively cuts off the blood supply to fat cells. And so when these fat cells die, especially in huge quantities, they need to be filtered out of the blood through the kidneys. And this can cause strain on the kidneys, and it can even push you into kidney failure, like in his case. And so, I wanted to discuss today about what he could have done differently in order to possibly recover his kidneys. But first, stage 5 kidney failure is a very serious problem because you often need to go to the hospital on a regular basis to get dialysis, to filter the waste products from your blood, which is normally what your kidneys would do, but in this case they can't because they're not functioning well, they're in failure, right? And so this can also cause anemia, for instance, because your kidneys produce EPO, or erythropoietin, which is what stimulates your bone marrow to produce red blood cells and hemoglobin. Now, Bostin Loyd also had anemia at that time, and he wanted to get prescribed EPO, but the doctors wouldn't give it to him. Instead, they wanted to give him an EPO stimulating agent. Now, these are an older class of drugs which they do work to a degree, but they're not going to be as effective as straight up EPO. So in Bostin's case, he decided to just order the EPO himself because he has sources for all this stuff. He's on a lot of drugs, obviously. Now, there are a new class of drugs which have come out since then called HIF ProloHydroxylase inhibitors. These work by inhibiting HIF ProloHydroxylase, which activates HIF, which is hypoxia-inducible factor. And this is what also downstream causes an increased EPO release from the kidneys, and they're generally safer than EPO-stimulating agents and more effective. Now, a good example of this would be roxadustat, and I talk about this actually even in the Peptide Mastery course as well, and how to use it, and where to get it, and how much to take, and all that. But in Bostin Loyd's case, he went on to take glutathione to try to heal his kidneys, right? And he was megadosing this, along with, I believe, some other supplements as well. But it just wasn't really restoring that kidney function. He'd often feel very fatigued, and he'd even be throwing up a lot of the time because he was getting these waste products building up in his blood. And in the gym, his performance was terrible. Like, he lost literally over 50% of his strength was gone. And so he unfortunately did end up passing away, although it wasn't actually from the kidney injury. It was from an aortic dissection, supposedly, at least according to the autopsy report, where your aorta, which is what is outside of your left ventricle, it's what your heart pumps during the systole, pumps blood out of the left ventricle into the aorta. It's your largest artery. And it became dissected from his heart, causing him to basically bleed out through his chest, which is a terrible way to die. I can't even imagine. But anyway, I just wanted to discuss, if I would have known all of this stuff about peptides back then that I know now, and if Bostin had access to this information, I really believe he could have done a lot more to heal his kidneys because, guys, in yesterday's video I talked about chronic kidney disease, but in Bostin's case it was an acute injury, and there are several peptides, which are actually Khavinson's peptides, which have been shown to help heal acute kidney injury. For example, after cisplatin-induced kidney injury. Cisplatin is a chemotherapy drug which in very high dosages can be used to cause kidney injury in animal studies. That's one way they do it so that they can evaluate drugs and other effective ways to improve kidney function. And there have been it's a handful of peptides that have been shown to actually heal kidneys after that cisplatin-induced kidney injury. And I just got to wonder, guys, if Bostin would have combined all of these peptide strategies with the glutathione that he was taking, megadoses of, and some other supplements, if he could have actually recovered his kidney function to a good degree, because this is something that is generally considered impossible. You know, traditional medicine has pretty much long accepted the fact that once you have a severe kidney injury, there's very little you can do to reverse the damage, unlike a liver injury in which your liver can regenerate to a good degree, although if it's injured too much, it often develops this fibrosis tissue, which can ultimately weaken it over time because scar tissue is weaker than normal tissue. And yeah, there are ways to actually prevent and even reverse to an extent like organ fibrosis. But yeah, in the case of kidneys, they can only regenerate, you know, they have very limited regeneration potential, at least without peptides. So guys, I actually talk about all this in my Peptide Master course, show you which peptides you could use for all organ injuries, not just your kidneys, and effective combinations of them. But this is also what we can do in our molecular bioenhancement coaching programs, which we are getting people, you know, results which are normally considered to be impossible. So if you're interested, just check the links in the description.